India to draft India's first national mental health policy released in October 2014. For those of you who have been following this particular industry, I'm sure his name is something which is not new to the ones who are part of this industry and this ecosystem. He has also served as a WHO consultant, assisting various countries in drafting their mental health legislations and helping them implement mental health policies there. Last but not the least, of course, with the kind of work that he has been doing, it's obvious that his primary interests are in the area of mental health policies, scaling up the services related to mental health, right-based care and legislation initiatives. He has also provided technical assistance to the Ministry of Health and Family Welfare, Government of India, in drafting India's new Mental Health Care Act 2017. So if any one of you have any questions regarding that, please wait till the end of the session and feel free to ask those. So with this heavy and intensive profile of a person sitting with us, I'm going to throw the first question out in the open. Soumitra, is we know and we are all worried about how this whole COVID-19 episode has affected everyone's life personally, right? With the way that the lives have completely shifted overnight for everyone. So are we actually confident, or can we say for sure that India in times to come is looking at a mental health crisis? And how should we go about looking at it?
Well, I mean, I'm not an astrologer, and I can't foretell what will happen. But what I can say is only based on what we know from the past. So sometimes past is your best predictor for the future. And what we do know is everyone's anticipating that there will be an economic crisis after the COVID lockdown is over. And, I read an article yesterday which said that India might go through a recession for the next 3 years or so. So clearly there is going to be an economic crisis. And so it's worth looking at past economic crises and seeing what happened to countries which had this kind of economic crisis and what was the mental health impact. So take Greece, for example. Greece is a great example. In 2008, they faced the brunt of the economic crisis. That's where the major crisis impacted in Europe, while the other countries were relatively spared. What did you see in Greece in the years after 2008, in the 3 or 4 years after 2008? For example, suicides shot up by a significant number. So if you look at 9, 10, 11, 12, the numbers went up by 17%, 25%, and then 40%. Okay, so that's a huge increase in suicides that happened with the economic crisis. We know from other economic crises, for example, that alcohol misuse or alcohol dependence increases during economic crisis. So you're going to see more alcohol related problems, you're going to see suicides, and you're going to see a general increase in mental health issues. So that's obviously going to happen.
Right.
Yeah, go on.
No, absolutely. Thank you for sharing, because I think you're absolutely right. It's the past that teaches us lessons, right? For us to be able to understand what's happening in current scenario. And we are all seeing the need and the emphasis on especially alcohol related problems. We are also seeing an increase in domestic violence issues. We are also seeing there are feeds and feeds if we go online, right? Wherein people are already getting frustrated with the status of lockdown continuing. And while there are people who are struggling with these issues and aspects of well-being on their own, workplaces have their own different agenda that they are operating on, right? The financial sustainability, stability, and scalability. I think scalability is something that no workplace is thinking at present, but the financial well-being remains to be the top priority for the companies and for workplaces right now. So keeping the financial well-being as a top priority, how do we communicate this message, or how important then does it become for companies who are going to be employing While there's a lot of layoffs layoffs which are happening in several organizations, and these are the people who will be required to deal with their own mental and emotional well-being at their end. The people who will stay behind and who will continue to be part of these organizations, how should the companies or the leaders of this organization shift their focus or balance their focus, that as they take care of the company's financial well-being, they should also be putting the focus on the mental well-being? And what is it that they should be in what approach, or what is the approach that they can take as they shift the focus toward the mental well-being of their employees?
Okay, I'll try, and that's a long question, but I'll try and address it in two parts. And just to quickly pick up on that bit about domestic violence, which you said, because that is an interesting thing. The kind of three-way relationship between domestic violence, alcohol use, and suicides. So in India, for example, 1/3 of women who die of suicide will report a history of domestic violence. Okay, domestic violence tends to be higher in families where the spouse is drinking or has a problem with alcohol. And so you see alcohol directly increases suicides, alcohol increases suicides through domestic violence, and now you got the economic crisis on top of it. So, I think it makes for a very heady kind of a mixture. Turning to your question about what can workplaces do, I think before you go to workplaces, I think let's step back a bit and ask ourselves, what can we do as a society or as a system or as the community, and what can government do? Because I think a company only works within the ecosystem of a community.
Yes.
And if you have an ecosystem which is completely deranged, then whatever you might do as a company, it might actually not work. So in the ecosystem, one of the things that we really do need to do, we got caught out with COVID. For example, with COVID, we just did not have our healthcare system in order, and it still isn't in great order. And so the whole idea of the lockdown is to buy time so that we can get our health systems in order. Now, the good thing or the good news for mental health issues is that we know from past experience that mental health issues happen after a lag period. So there's going to be like a 6-month or a 12-month lag period before the mental health crisis will hit us. So something that we should be doing now, having learned from the COVID crisis, is to actually put in place and build up our mental health system, because that's in utter shambles at the moment. And not wait for another 6 months down the road when the crisis hits us, and then we are scrambling to try and put something in place. So I think focusing on doing something now as a way of addressing something that is likely to happen in 6 or 9 months' time is something that not only governments but our communities as well as our employers need to start thinking of. So why think of mental health today and not wait for it to happen? Is actually you can do something about it today. Right. The second thing that employers can do and governments need to do is, what happens is that the anxiety and the anticipation of a crisis is actually worse than the crisis itself sometimes. So, for example, the anticipation of job losses is going to cause a lot of anticipatory anxiety, and frequently, knowing how we all are, you imagine the worst. You imagine things to be worse than they will be actually. And so people people will start thinking of the worst possible scenarios for their jobs and everything. Now, I think governments need to do something today to try and take people off that anxiety. So, for example, some governments have done that. Like Canada has said that for every employer, we will pay out the 80% of the salaries. Right. You pay 20%, we pay 80%, you keep people in jobs. Now that's a huge, it's not huge only from the money aspect of the thing, but it's huge also because it just takes away that anxiety, which is actually the killer, because this anticipation of something terrible happening is worse than the terrible thing happening. So, that's something that governments need to do today, which is to say, look, we'll underwrite something, we'll provide a basic thing. And that's particularly important in countries like India, where there's no social security net, in other countries, even if you became unemployed, you might get an unemployment benefit or something. In India, there's nothing of that sort. In India, what you rely on is your family social security system. You rely on your families, you rely on your friends. Now, that's not going to work this time. because your friends and family are all going to be in the same boat with you.
Everyone is, yeah.
Everyone's in the same boat, so they are going to be as stressed out, and they're going to be as troubled by their economic situation as you are. Whereas normally when you lose a job, your family and friends have not lost their jobs. They have a job, they're willing to support you, they have the capacity to support you. So here it's going to be really difficult. So this is not like the usual times when people lose a job. Okay, so that's important. I think also companies need to address this. So if if you, for example, know that people's anxieties are going to be worse, to actually proactively announce and say, listen, this is what's going to happen, this is the scenario, this is how we are trying to keep everybody in a job. It might mean you have to take a pay cut, for example, or it might mean that we are underwriting 80% of the jobs, or it might mean that we are underwriting 80% of the salaries. Or if there are difficulties, to say, look, if XYZ does not change, then we might not have people who have jobs. I think being very clear about what is going to happen in the 6 months or 12 months to come can actually help your employees start to plan their own future, rather than live in this kind of constant anxiety, not knowing what will strike them the next morning. So I think companies could also do quite a bit for their employees in that sense. Like, for example, letting people know that your job is safe, or safe for X amount of time, or not safe for X amount of time. So that's something that companies should be doing, I think, and can do, and government should be doing and can do. And obviously there are things that we as individuals should be doing and can do, and we'll talk about that later. But I think at various levels, people need to do different things.
Yes, yes. No, the problem exists in different layers, and it's a top-bottom, or it's a clustered approach also towards solution. So while the government at their own level should be doing something, there's always this corporate responsibility, and then there's a social responsibility, and of course, nobody can take away the individual contribution and the responsibility that all of us can play. And going back to what you were saying, yes, companies should be able to prepare not only themselves in terms of manpower planning and identifying what are the ripple effects which are going to be in months to come or in years to come, and clearly communicate to their team members as to what exactly is the status going to be in times to come. And we all have seen there are different announcements that have come up from some certain organizations where they have tried to assure their employees, but somehow the assurance was not able to stay true to the words, and that has created more ripples, because when it happens with one or two organizations like that, other people also stop believing whatever claims are being made from the organization, and that only increases the anxiety, right? So
unfortunately in India, the only time you get assurances is when things are really bad. And so when you get an assurance, you actually think, oh my God, this is really terrible. The only time they tell you, stop worrying, don't worry, is when you know that, oh, it's so bad that they're telling you, don't worry.
That we need an assurance now.
Yes.
That is true.
So,
and especially for a topic like this, or for a problem like this, it's not a visible problem. Yes. Right? When we talk about the mental and emotional well-being of an individual, this is not something that is visible on a person's face all the time. And especially right now, we can't even meet everybody. So the state, what is happening inside a person, there have been enough conversations in the past also when everything was normal, the normal that we used to know as it used to be, that the stress level of people working in the organizations is increasing over time, especially in certain industries, or especially if they are part of certain kind of job profiles. And the increasing amount of pressure has already been a concern for the working population of the country as we go back to 3 months before. But with the COVID-19 happening, and the question mark with respect to the continuity of job being added to it, this invisible problem still continues to remain invisible, and it has still not caught the priority eyes of the employers. So while on one hand they can plan for the manpower resources for the future and communicate it, is this a time where companies should seriously and sincerely start allocating budget and resources toward trained counselors in the workplaces?
Well, I mean, I'll talk about the trained counselors, but I think I would always say that a crisis is an opportunity. And maybe this is an opportunity for companies to actually do a wholesale look at their own processes and say, okay, what is it about our processes that is causing anxiety or that causes mental health problems, and how can we address those? What can we do to try and minimize the impact of our processes on people's mental health? And that's something that companies who, people running the companies know best rather than any outsider. So actually, this might be a great opportunity to say, hey, look, this is great. We will now look at the whole mental health issue. Why companies should look at the mental health issue? There's two other important reasons. Mental health is also tied to physical health. So if you're not well mentally, it's going to impact your physical health. And secondly, it impacts your productivity. What is described as presenteeism, which means people are present but not actually performing as well because there is a hidden mental health problem which is not being addressed. So I think that needs to really happen. As to turn to your question specifically about having counselors at the workplace, I tend to have a very different opinion on this, and maybe that's not the mainstream opinion. But I actually don't believe you should have counselors at the workplace. And let me try and tell you why I think we shouldn't have counselors and what is the alternative. Okay,
Yes.
Because if you're going to say no to something, you have to offer us a solution. The reason I say no is because even in normal circumstances, when job losses are not an issue, how many of us would want to walk through a door in your office which says counselor? Most of us will not do that. The stigma associated with having to see a counselor in the workplace where you're working is so high that we know from experience, whether it is schools, whether it is colleges, whether it is workplaces, that people do not approach the workplace counselor.
Right.
So if companies are going to look at workplace counselors as a solution to the mental health problem, oh, we've done that, so now we've taken care of it, then it's not going to do anything at all. You go to colleges and the counselor will say, nobody comes to see me. Now, that doesn't mean that there are no mental health problems, but people will not go to see them because they're worried about confidentiality. They're worried about how this will impact their work. They're worried about, will they lose their job because of this? See, when companies are now likely to downsize, you don't want to be the person who has a mental health problem because you're worried then that your company will say, oh, one more reason why he should be on the block rather than somebody else, So I don't think that a workplace counselor is the solution to the problem. There are better options. There are better ways of doing it. For example, having an employee assistance program which is independent of the company and where complete confidentiality is assured. So, for example, I work as a counselor for a couple of colleges as a psychiatrist where the students know they can come to me and the students do not, I don't have to provide any information to the college. The students can approach me and the college underwrites all the expense. But when they get billed, the college does not get details about who had come. They just have to accept my word for it that, okay, I saw 3 people or I saw 2 people. And that's the arrangement which has worked very well. Now that gives the students a complete confidentiality that even the fact that they have gone to a counselor is not something that is known to them. Now, even with that, there are problems. I was just speaking to a very large PSU, which has an employee assistance program. And one of the HR managers saying that we want to encourage people to use it. People are not using it. So you see, even when you have those issues, people still don't use it. And if you had somebody inside, then I doubt people are going to use it. The other thing to do, which is also equally simple thing to do, is to actually maybe provide insurance, provide medical insurance, which allows somebody to go and see a counselor or take help from a counselor or have a list of counselors who you can recommend to your staff. But I think more than all of this, your employees can find a counselor if they want, they can find a psychiatrist if they want. More than all of this is actually changing the culture of the workplace. If you change the culture of the workplace where conversations about mental health issues are seen as everyday normal things, then I suspect you will find different ways that people will approach it. And the other thing that workplaces need to do is to actually provide some kind of accommodations, and I don't mean accommodation meaning a place to live. What I mean by accommodations is, for example, somebody with a mental health problem may have difficulty waking up early in the morning. Okay, in which case you might want to say, listen, it's okay if you work hours which start late and end late, because that suits you better. Or maybe in once in 15 days I need to go and see my counselor and I need 2 hours off for that. Now companies could adjust for those 2 hours and say, fine, you can take time off and go for that, and you can adjust that time somewhere else. So I think many of these adjustments don't actually cost companies anything. By saying, instead of working a 9 to 5 job, why don't you work from 12 to 7? The person is still doing the same work and the same amount of work. You're just allowing them some flexibility, or saying, I need to go and see my counselor on Thursday evening, so I'll come in early on Friday morning and do extra work. Now that's something that companies can do without losing productivity. So I think changing the culture of the company and providing these kind of accommodations is probably far more useful and important than just saying we've got a workplace counselor. I think the workplace counselor is not a one-stop panacea for all these ills. Companies really need to invest on how they see things and how they talk about mental health.
No, absolutely. Thank you for stating it like that, because a lot of companies, when they approach not just us, but also other fellow practitioners, and they're constantly seeking out the solution in counselors, right? That we just want to provide counseling to our employees. Now, the intent is good. Intent, of course, everyone is coming from a very good place, but does it hit the core problem and provide the core solution? Is something that needs to be reflected upon. A lot of times, just changing the ambience or the environment of an office. Till the time we used to have brick and mortar and all of us used to go to office, companies used to think that if we will actually redecorate the office, or we will take people for some team outing, or we will let them have this, one Friday evening off, it is going to help them relieve from the stress that they're feeling. But these are patchworks.
Yes.
These are not focusing on the foundational level problems. So going back to the culture, going back to the nuances and the ingredients of the culture that is cultivating stress, right? And a person can be stressed for so many reasons, Soumitra, right? There are personal reasons, there are social reasons. I may get stressed because of the route that I have from my home to my office. I may be stressed because of things happening in my personal life. So while an employer cannot take care of each and every stress contributor in my life, to begin with, it's always better to look at the company's culture and where all things can be taken care from their angle. And counselor, most of the time, one of the participants also asked when you were speaking that is it okay to have a list of counselors ready, just in case somebody wants to access them. Right? And immediately when the question came right after that, you had already shared this thing that it's better to have a list of counselors ready instead of having them internally, because the stigma follows. So as long as there can be absolute confidentiality, privacy intact, this is something that can be given as a complementary instead of a one-stop solution. But for that also, see who is designing all these things in workplaces, right? That's very crucial. Right now, you and I are having this conversation, of course, you from the domain expertise, us, because we keep talking to companies which are struggling with these conversations right now. And everyone is, from the company side, majority of them are struggling to find the right kind of solution and approach towards managing employees' mental well-being, not just right now, but in times to come. We do not know how long this is going to continue. So for this particular level of understanding, HR generally ends up playing the important role, right? Yes, the leaders of a company, if you're talking about a small setup, where founders huddle up and they are concerned about it directly, because the org hierarchy has not expanded so much, and they're still responsible, directly and accountable directly for everything that is happening to each and every member. But when the org hierarchy extends too much, it's the HR who is generally assigned with this responsibility. And for HR, the continuous education does not really happen, right? This is more of a reaction rather than a proactive learning. So what kind of what exactly would be the key three things that you would like to suggest, or provide as an ingredient to HR professionals when they are right now thinking about putting structures and programs, other than looking at the culture, of course, but what are the three activities they can do or three ingredients they can introduce? One you have already mentioned, putting together a list of counselors and making sure that it does not really create a taboo for anybody if they find access in them. What are the other things that an HR professional can do in today's time to ensure the well-being, the mental well-being of the employees in the company?
Well, I mean, one of the things that I've noticed with HR departments, okay, is that I mean, in companies' hierarchies, usually HR is not very high up in the hierarchy. You know, somebody who's managing the finance and all would be seen as a in the hierarchy of pecking order in companies. The HR person tends to be anyway lower down in the hierarchy. And then what I find within HR departments, and that's reflected then in the HR departments, that within HR departments, the role of mental health well-being or health and well-being is seen as a very soft thing. It's not seen as the most important thing. And it's something that is then delegated down to the not immediate, not the complete lowest, but very much to the lower end of the hierarchy. So one of the things that HR probably needs to do HR departments need to do right away is to have the top person within the HR department say, look, this is an important part of what I want to be doing. And that gives it a sense of importance, which otherwise it lacks. Because very often I've seen that they will say, oh, can we not do this or can we do that? And everything that you suggest has to be worked around the system rather than worked within the system. So it has to be, it's seen as a kind of good to have, but not a must have. You know what I mean? Like if it was a must have, then they would make the effort to make those necessary changes. And so I think it's important for companies to start thinking of, and there's a lot of talk about human resources and how our human resources are like our physical resources and all of that stuff. I mean, a lot of it is talk. It does not translate into action. So I think one of the things that HR departments need to do as the first thing is to convert this talk into real action. And that conversion will not happen unless the senior most person in that HR department or in a small company, the senior most person who's handling the HR role makes this a priority, takes this on as a priority and says, look, this is something that is important to me. This is what I'm going to be looking into and I'm going to do something about. So I think that's one thing that they definitely do need to do. The second thing that HR departments can do is, in a sense, your past behavior, you could say anything. Your employees don't believe as much as what you say, as much as what you do. So, what you do is more important than what you say. So, for example, if you talk about mental health and how it is important, but there is a record that every time somebody has a mental health problem, they are asked to leave, then clearly what you do is very different to what you're saying. And then there's no kind of coherence between your words and your deeds, and people trust your deeds rather than your words. So they're going to not pay attention. So I think having some degree of coherence in that whole process is equally an important thing that HR departments should be doing. And the third thing that HR departments need to really do is, sometimes just doing the most obvious thing is important.
Yes.
And we don't do the most obvious thing. So like if somebody looks depressed, then the most obvious thing to do would be to say, listen, can I sit down with you and find out what's wrong?
Just talk.
Yes, just do the obvious thing. If you're seeing somebody distressed, then maybe have a chat and say, listen, can I help you in some way, or do that? And it doesn't require major processes. It doesn't require a lot of stuff. And there's a lot of things you can do within yourself. Companies don't tend to do this, but most people do not need to go and see a professional counselor. Okay, you don't need to have everyone going to see a professional counselor. Even less, you need everyone going and seeing a psychiatrist like me. I mean, that's just not necessary. So there is a lot of stuff that we can do informally within our own community. So, for example, peer counseling is a great thing to try. Okay, get your, there's always some employees who have a kind of leadership skills, who like to help other people identify those employees and maybe get them trained in doing peer counseling. You're more likely to talk to somebody who works with you because you spend 8 hours a day with them, and you're comfortable talking with them. And then that does not get stigmatized, or there is a less risk of stigma happening. But if your peer counselor is trained, then you got a resource within your own company rather than having to ask people to go outside. And good companies will even give that peer counselor a certain amount of time in a week. They'll say, listen, 2 hours in a week are protected for you to do this peer counseling. So we
Right.
understand this is extra work you do, but here's 2 hours of protected time for that. Now, these are the kind of things that you need to be looking at, rather than a very notional, simplistic idea of, you got a mental health problem, go and see a professional. It's not needed very often.
Yes, no, absolutely, and that's the strategy. I think that HR is now starting as a learning curve. We have just stumbled for years and years. Mental well-being has been talked about in a very hushed manner, and the stigma associated with a lot of topics around it does not allow people to come and speak also, right? Because we want people who are always efficient, effective, positive, bright, vibrant, go-getters, and communicative, always with a smile on their face, able to handle stress well, pressure well, work-life balance, not an issue at all. We want the perfect employee, right?
Yes.
So the last thing that we want somebody to say or come is that today they don't feel as productive as they were feeling, let's say, yesterday. Today, the stress is a little bit much. So the competitive drive does not allow people to speak openly about it. And it is time for HR, considering whatever we have been pushed into because of COVID-19, it has now suddenly become a priority, because a lot of people who are returning from who will be returning, we don't know when actually the lockdown will be properly over. But from whatever experiences, a lot of people, when they will be returning back to the work, it is something that will become a priority for the HR. And even right now, people who are working from home continue, and a lot of companies have announced already that they will say that they will let their team members work from home for a certain duration in times to come. We do not know what our members are going through. So now the productivity requires a deeper engagement and involvement in how my team is going through at a mental state. What is happening to them? What are they feeling? What are they experiencing? What are they thinking? So that's why I had asked for the 3 pointers, which I'm sure will be very helpful for the HR to come about. But there's another complication to it here, Soumitra, right? People are different. Each employee, each individual is different. And I'm not even just talking about from the gender angle here, right? Of course, it's not possible to look at the male psychology and a female psychology and a person from another gender psychology in the same sense, because how we think, how we feel, how we behave is very different. It's deeper conditioning, right? So just looking at the surface level differentiating factor, it gets further complicated, because people coming from this diverse gender profile, people are also coming from a very diverse socio-economic profile, as well as the cultural profile, and the infrastructural dynamics of each one's home is also affecting to the individual employee mental well-being right now, right? How should then an HR struggle to work around all these things? It's a complex formula.
It is. I mean, there is no one set mathematical formula to this. But what I would first of all say to companies more than to HR, because I think sometimes convincing HR is easier, but convincing the companies to actually allow HR to do some things is harder. And one of the things that I think, the problem we've had with a lot of health as well as mental health issues is it is seen as a charity. It's seen as, well, I'll try and be nice to my employees because it's a good thing to do, not because it benefits me. So it's seen as I have to go out of my way to do something, even if it costs me something, because I need to be nice to people. And I think that's the wrong way to go about approaching it. You don't have to be nice to people. You don't have to go out of your way to help people because it's a good thing to do. I would appeal to employers to their self-interest. Okay, it's very simple. Look at the costs of depression. Okay, for every $10 that depression costs us and costs society. Okay, I mean it's a cost to society.
Yeah.
For every $10 of cost of depression to society, only about $2 is actually spent on treatment. Okay,
Yes.
the remaining $8 is almost completely accounted by reduction in output. Okay, reduction in people's functional output, which means really it is a loss for the companies, because they're, because people are depressed. So and depression tends to be like an iceberg. You see the bits above the water, but there's a whole big bit under the water which you don't see. And
Right.
and companies are effectively paying a price for that without realizing it. That's there are estimates from UK and USA, for example, which say that depression probably reduces GDP by 1 to 2%. That's a
Yes.
huge amount of money that we are looking. So if you could save $8 by spending $2, wouldn't you save it?
Of
So
course, I will.
exactly. So my point to companies is that stop seeing this as charity. I'm not even asking them to see this as a matter of labor rights. Okay,
Yeah.
I'm not asking them to say, "No, look at it as employee rights." Forget the rights. Forget the charity. Just purely think of it from your own selfish self-interest.
Look at it as a business mandate,
Yes,
right?
it's a business thing. You could make money. If you help, if you improve the mental health of your employees, or if you improve the mental health situation in your organization, you're going to save money.
Yes.
So, it is purely self-interest which should drive you to do it. And I mean, companies spend so much time trying to do cost cutting because, they say, oh, we can't raise our prices. We need to reduce our costs, and our margins are so thin. Here is a big amount of money which is on the table, which you're not addressing. You could cut your costs dramatically by saving this huge amount of money. So, I think that companies need to stop, really look at it as a strategy, as part of the business strategy, not as a additional extra. They need to say, okay, as part of our business strategy, what are we doing about the mental health of our employees? Because that will pay us money. It'll pay us dividends in some sort of way. And I think if you change that whole metric to think that way, then
Yeah.
you don't feel what you're doing is onerous, because then you don't see it as an expense. You see it as a way of reducing your costs.
No,
You see the money. You see the money spent as a way of reducing costs and improving your bottom line. So my appeal to companies has never been on the basis of charity, because charity only takes you so far.
true.
The best appeal to make is to say, look, there is money to be saved, there's money to be made. Why don't you invest into that? And I would strongly, I don't know if there are any HR people on the call, but one of the things that they need to go and talk to their people and bosses really is to say, listen, I can save you money.
Yeah. Yeah.
And that's usually a better conversation starter in an organization than to say, I need you to spend money. You're not
Yes.
going in there asking them to spend money. You're asking them, saying, I could save you money if we did X, Y, Z. So, I think we need to change our entire way of looking at it, how we look at it. And given what COVID has done, uh, all companies are going to be trying to reduce their costs. Okay, because everyone knows that reducing cost is probably your only way of trying to survive or make a profit.
We don't know any other way, Soumitra. That's the first thing we want to do, expenses. Let's cut the
Yes,
expenses.
exactly. But the way to reduce your costs might actually be, see, what happens is that if you paid for a car, let's say you paid for somebody to go and see a psychiatrist, you see that as an expense. What you don't see is that if that person got well 3 weeks earlier than what they would have got well, and what their productivity in those 3 weeks will do for you, and how much it will pay back to you.
Right.
So, if you start looking at it that way, then you see that actually this is no longer an expense, it's a way of reducing my costs.
No,
So I would strongly urge employers to start looking at it that way, rather than to say, oh, we're doing something, we're doing a lot of good for it. It's not CSR, it's not charity, it's not even about rights.
right.
While you could make all of those arguments, look, it's about people's rights, it's about employee rights, about employee welfare. You could do all of that. I think that's beside the point. Let's focus purely on what will benefit you as an employer.
Right. So I remember there was a time almost like 10, 20 years ago when employees leaving and joining was not a concern, right?
Yes.
The whole conversation on why should we keep our employees engaged. Now the
Yes.
employee engagement is a big term, and HR has one of these things as a KRA, for them to deliver upon. But keeping an employee engaged was not something that was under the primary mandate of any company. Now that became important because somewhere the conversation on employee leaving and a company having new members join in, invest in their training, and then them leaving again. The whole metric system, or the whole the data around employee attrition and retention was somewhere calculated, and companies were able to see that, okay, we actually lose more money if
Yes.
people come and join and leave very rampantly.
Yes.
And it makes more sense for us money wise, right, that we spend time in making sure that their employee remains engaged. They are not just happy, but they're actually satisfied. The job satisfaction has to happen. And it worked in their favor. And that's where all the investments around their learning, their career progression, and health and everything became primary. Now, when we talk about mental health and the investment, it's not an expense. We are telling companies that change the narrative. Don't look at it as an expense, but look at it as an investment. Sumit, is there any metric system that exists right now that will allow company, or can you suggest something in since you have been working in this field like extensively, some metrics that companies or the HR can track? This is also a question actually which has come from one of our viewers, when they're curious in understanding is there any metric system that companies or HR can use to measure,
Well, I mean, one of the easiest metrics, and it may not apply to all companies, but one of the easiest metrics which has been used is absenteeism. Okay. There is a lot of evidence to show that absenteeism, meaning short absenteeism, not the kind of long-term thing, but absenteeism is a good proxy indicator of the mental health in your company. If you want to know the mental health of your employees, look at their absenteeism rates, and if you can bring absenteeism down, you probably need to impact on the mental health to bring that absenteeism down. So it's a proxy indicator, but a reasonably good indicator. The other thing to do is, and that's harder to count, but what I said earlier about presenteeism, which is talking to managers and saying, listen, people may not be absent and they're present, but they're actually not delivering good quality output or not delivering enough output. And getting a way of measuring that with your managers and seeing whether that improves over time. Now, presenteeism is almost always because of mental health problems, or very frequently because of mental health problems. The other, and absenteeism never gets put down as mental health problems. That's the other thing people need to understand. Yes. Employees don't say, I'm not coming to work today because I'm depressed. Well, employees will say, I've got a cough, I've got a cold today, I've got a fever today, and that's why I'm not coming into work. They will never say that because I'm feeling low or down or I'm feeling bullied or any of that stuff. They will only say, I've got a cough, or I've got a cold, I've got a flu, and all that kind of stuff. So very often, absenteeism if you look for mental health reasons for absenteeism, you'll probably find none. What you'll find is a lot of physical health reasons, because people will displace. When people are upset, they always even use metaphors which are physical metaphors. When we talk about anxiety, we say a knot in the stomach, for example. Now that's a physical way of talking about, or we say, oh, he's such a headache. He's giving me a headache does not mean you got a physical headache, but what you're saying is somebody is causing stress.
That's because people also do not know the language of expressing their emotional and mental state of being. Majority of us were never taught this language.
But to answer your question directly, looking at absenteeism rates, for example, is a very good proxy indicator for companies to talk to your managers and try and set up some metric for presenteeism, which is equally a big problem with mental illness. So somebody who's mentally unwell comes into work but is not being productive at all, because they're just there and they kind of waste their time. because they just can't bring themselves to do the work. So those are some of the things that people can do. And of course, there are more, there are even more sophisticated ways you can measure. You can do anonymous surveys in your organization and all of that stuff. But here are things where the measure of that is something you can take to your bosses. If you're HR and if you say, listen, we're tracking absenteeism, it's running at this level, and if we do these initiatives, we are hoping to bring it down by 10%, for example. And that's something that at the end of the year, you could go and say, listen, 10% reduction in absenteeism. Now, that's a significant gain for a company to look at. So, that's why I'm kind of saying these, because they can be then quantified into money amounts. You can put a dollar value to a reduction in absenteeism, whereas many of the other things you may not be able to put a dollar value on. So just a couple of these suggestions companies can do to try and look at what's going on.
No, I think even the one metric that you're saying, absenteeism, because presenteeism is a more deeper concept.
Yes.
It will require for the HR leaders for them to understand it first, and that is a continuous learning process. But absenteeism is something which can immediately be tracked. I mean, even if they were if they were giving the excuse of being unwell earlier, you can easily track that there are 10% less people who are falling sick now because of what we are doing.
Exactly.
We may not know the real reason, but at least we can track it, and that's more important than that. But so here's a complicated one. Now I'm already taking questions from the viewers, so I'm incorporating the questions, and they're so beautifully woven together that I think they're just connecting one after the other. This becomes more difficult when we expand the definition of the workplace, right? So far, we have been talking about workplace in our common understanding and terminologies of four walls, and people coming, and there's attendance concept, and you can track it. Language barrier is not there, social barrier is not there. But when we look at workplace as a workplace, which could be any place, right, it becomes more of a challenge, because these kind of initiatives should not remain limited to the selected few. So how do you suggest the HR can actually navigate around this problem?
Well, I mean, organizations which have always relied on structural factors to ensure that their employees were productive, which means, for example, having a check-in time, having a checkout time, and ensuring they're sitting at your desk, things where the focus was on the structure and on the time rather than on the work, has always, they're going to find this transition much more difficult to do. On the other hand, organizations which were not focused on the structure or were not focused on the time, but were actually focused on having some deliverables done in a certain time, and then letting employees go off and do it in their own way, will not find this any different, because they were doing the same thing before and nothing is going to change. So if you had a situation where you told your employee that I need you to deliver ABCD in this week, okay, and that's your delivery for this week. Now, whether you come in at 9 or you leave at 10 or you don't come in at all, I'm not even going to bother with it. As long as at the end of the week, you have delivered this, and that's all that matters to me.
Right.
Now, if that's the culture in which you're working, then it's easier to kind of shift. Now, clearly, that may not be a culture which can be applied to each and every single job. True. Because if some jobs do require you to be at your desk and doing something, if you're the receptionist, for example, you can't have a receptionist saying, well, I'll be at home and if somebody comes, I'll drop in. They can't. So some jobs can't have that. But even there, one can be creative about what people are trying to do. So I think that what HR really need to do is to shift their focus on structural monitoring to more outcome monitoring. We've frequently, the focus in companies or in organizations is on outputs rather than outcomes. So we don't focus on outcomes, we focus on outputs. And that happens.
Soumitra, I'm going to interrupt you for the viewer's sake. It will be great if you can provide the distinction between output and outcome. It will be great.
Well, I'll give you the example of because government is very good at this. Government always focuses on outputs, and I'll use a government as an example. So they'll say, We have provided 20 doctors in this village, or we have provided 50 nurses. These are outputs. These are not outcomes. Because you may have provided doctors, but has that made any difference to anybody's life, which is the outcome you're looking for? And there is a presumption that because the output or input is there, you could say the doctor is an input, or the doctor is an input and he sits at the clinic every day, which means that's an output. And because he's sitting at the clinic every day, then he must be doing some good. Now we know that outcomes don't happen that way. You know, for example, inputs and outputs don't necessarily result in outcomes, because we track outputs very happily, and the outputs are easier to track. Outcomes are harder to track, you know. And so and this is what usually will happen with some departments. See, like for example, with the sales department in most organizations, they are measured on outcomes. You know, for them to say, I made 20 sales calls is not good enough. You know, well, that's no use. How many sales did you do? Because that's the outcome. So, you know, some departments in the organization always work on an outcome basis, but many departments may not be working that way. And so for HR to shift everybody, especially when you're doing remote working, to shift people's thinking to say, look, we'll focus on outcomes, we'll not focus on outputs, is very important. And it's a challenge, because some organizations will take to it like water. Like the sales department will understand that easily, because they'll say, oh, we always focused on outcomes. You know, we had to get a sale. We couldn't tell you that I made 50 sales calls, but I didn't make a single sale. You're not going to listen to that. So, you know, it's easy for some. For others, it'll be much more difficult. How do you...
Absolutely.
You know, what do you do as an outcome? You know, for some jobs, how do you define an outcome? So defining outcomes is as important as, you know, than measuring outcomes.
No, very true, actually. And we at our end also struggle with it a lot of times, wherein telling internally or as well as externally, just action is different from output, is different from outcome, right?
Yes.
And we should be able to find that distinction, not just for a collective mental well-being, but also individual, because you need to feel connected with what you're creating and what you're contributing to. So yes, that's very important. And thank you for explaining it. Examples become very crucial for everybody to understand what the concepts are. So the reason I had asked this question, and while I interrupted you in between, is for companies, people working at the bottom of the pyramid, right? And now we are talking about companies in construction industries and artisans. There, the reach will take its own time, right? And there is no quick hack to it. So the output versus outcome concept that you are saying, I'm just gonna see if this is extension of this. Is this something that you would suggest is applicable to these structures as well?
Oh, I think it applies to any job you do. I think outputs and outcomes apply to every job you do. I don't think, you know, I mean, let's say if I were to apply to the person who comes to clean our offices, you know, his output is that he comes and sweeps the floor every day. The outcome is I have a clean office.
Right.
Okay. And I'm focused on the clean office. I don't give a damn how much time he spent or didn't spend, as long as the office is clean. So now you could apply the same output-outcome logic to even a job which in that sense is not highly skilled and all. You know, he's the cleaning person. He comes and cleans the office. And you could apply an outcome logic with that person and say, listen, the outcome we're looking for is a clean office. We're not going to measure you on output. Did you sweep today? Did you swipe today? How many times in a day did you do today? That's not what we are looking for. What we are looking for is outcomes. So, you know, and clearly you can't have any outcomes without outputs. But because you have lots of outputs does not mean there are outcomes. And I think that's equally important. And so you could apply this logic to almost many jobs and say, look, we'll focus on the outcome. And I gave you an example of a cleaning person because that's about as low end a job that happens in most companies.
No, very helpful, because for them to be able to do it as a task, for HR to be able to do it as a task and, go back to the metrics and then be able to measure the well-being that we are talking about, it's very important to define these things. What reflects as an action and what reflects as a productive state of being.
Yes.
These two
Yes.
distinctions are very helpful. I'm going to take next question from one of our viewers, who has asked that while we are talking about HR putting in systems and being proactive and preventive about a lot of things, how should HR go about, or how should companies go about handling if ever somebody comes back to work, or comes in the work environment and decides to open up about, let's say, a crisis going on in personal life, or a crisis that is not allowing them to be at their best healthy self in an emotional state of being. Is it something that HR should be focusing on? Is this something that companies should be taking in as a responsibility? What is your take on that?
I mean, I wouldn't, I wouldn't say that companies should take that as a responsibility. But like the example you're saying is, if somebody walked into my office and said, "Look, I have a mental health issue. I want to talk to you about it," then clearly talking to them about it matters. And you don't need to be a professional to be able to do it. There is this weird idea in people's head that that only a professional can talk to a person with mental health problems. It's as if people with mental health problems are people with green horns or cats or animals or lions, and you need the lion tamer only who can deal with them. I mean, anyone can talk to anybody. Very often what you need is just basic human kind of contact and a way of doing it. You would do that with anybody. You don't have to be an expert, and you can't mess it up. There's this fear, oh my God, I'll mess it up. Well, you can't mess it up. You will mess it up even more if you say, I can't deal with it, but I'll find you a professional who can deal with it. Now, that will actually mess it up further than what, because that person at that point was not looking for that.
Right.
They were just looking for somebody to have a quick chat with.
Right.
So, I think one of the things that people need to get out of their head is somehow that mental health or mental illness is something so sophisticated, so complicated, that only a few people with huge amounts of training can do it. I don't think that's true. I think all of us in our own sort of ways have skill sets to do things, and many of the skill sets I'm talking about are skill sets you need not just for being able to counsel someone. These are skill sets that are useful to you in your job. So for example, I'll give you examples. Active listening. To be able to listen to somebody, okay, just learning active listening is a skill as an HR you need to learn, not because you'll have somebody with mental health problems to come to you, but you need to learn active listening anyway, okay? Problem solving, there are techniques of problem solving. Why should you learn problem solving? Because you need it everywhere. Everything you do on a daily basis requires problem solving skills. And those are the kind of things you can easily use with somebody who comes and talks to you about a mental health issue. So, I would want to discourage this idea and notion somehow that people with mental health problems are people from Mars or different from us or need very different handling. I think they're just, it's a bit like they're same like us, and sometimes we are sitting on the other side, and sometimes they are sitting on the other side, and that's really how I would look at mental health.
That's true. That's true. While you were saying active listening, I was thinking about empathy as one of the ingredient. I mean, these are all the traits: being non-judgmental, being a good listener.
Yes, I
Forget
mean,
about
that's all
being
you
a
need
good
to
teacher.
do. That's all you need to do. You don't need to do most of the time. 9 out of 10 times, that's all you need to do. Of course, there'll be time when you need more, but let's get the basic stuff out of the way.
I think as long as we are not writing prescriptions, all these will suffice.
Yes. Well, I look. I didn't come anywhere near a prescription or medicine.
That's
Did
what
you
I'm
hear?
saying, right? People, but you were saying, because a lot of times when we have had these conversations and people, and with all due respect to all the certified counselors and everybody, um, what you're saying is absolutely right. Sometimes it's just a person sitting across you who wants to share something,
Yes.
and they may not be a solution that your colleague is looking out for you, but maybe just somebody to listen, right? And that's all that is needed.
Yes.
I I do believe, though, Soumitra, that in workplaces because this trait is not sought. People have not activated this. All the
Yes.
characteristics are there. What you're saying about being a good listener is there, present in every person who is good in sales. You
Okay.
cannot be good in sales if you're not a good listener,
Yes.
right? So it's present. But because this trait, this characteristic is not associated with this particular subject area, because the conversation has not evolved to introduce them, that for very simple thing, if you're good with knives, you can either be a good chef or you can be a lot of things if you're good with knives, right? So same thing with the skills also. The HR or the companies or even conversations like this, what it allows people to know or understand is that I already have the traits which are needed to be the support that I'm seeking from the company that I'm part of, or the team. While at a larger level, the government will take its own course, companies will do that, HR will do it, and everybody. This is where you're speaking about the individual responsibility, that why should I wait for a counselor to get appointed in the organization before I start being concerned about what's happening in my team, right? And that's the takeaway that I took from everything that you shared on this
Yes.
particular aspect. Um, for so this once again is a connection with one of the questions that somebody is asking, that while this might be a solution for companies which do not have huge HR budgets, right? But even still, you need, as an entrepreneur, this person is asking, this person, they have two startups and they're part of an entrepreneur network also, where a lot of people are facing problems, right? And how do they reach out to those people and create a space without actually investing in a large amount of money, resources, and all these things around? So perhaps I
Well,
think
in fact, I mean, everything that I've been saying is actually not asking for an investment of large amounts of money at all. I'm saying this is stuff you can do. You don't need to call in any experts. You don't need to call in any consultants. It's stuff that you can do. You use your own skill sets to deal with it, and you can deal with a lot of bits, and only some little bits might require a specialist help. Uh, I think companies need to stop seeing this as a problem. At the moment it is seen as a problem. Okay, how do we deal with this problem? You
yes,
need to stop seeing this as a problem. You need to start seeing this as an integral part of your employee. So, just like you would ensure that your employees had a comfortable place to sit because it will improve their productivity,
yes,
you see that as an integral part of what you provide. You need to see this in the same sort of way, that this is something you'll provide because it will improve their productivity. It's not a problem to solve. It's not a problem to push away. I think very often what has happened is it's perceived as a problem, and then you want somebody to take away the problem because, look,
yes,
I just want someone to take away the problem. It's not a problem. And it's not going to go away. You can try to take it away, but it won't go away. So, you're better off actually dealing with it by not looking at it as a problem to be either brushed under the carpet or to be thrown out of the window. You want to actually deal with it because it's something that is integral to your workplace, and it's integral to how you are and what you are. So, I would say that everything I've been saying up to now actually is not asking for, I'm
yes,
not suggesting go and get a professional to come in and talk to your employees. Not at all. I didn't say that once even. I mean, in fact, I find that a complete waste of time. I get asked by companies to come and say, can you do a talk on stress management? What's the use of that? I mean, HR will be very happy because at the end of the year in the annual report, they're able to then say, oh, we did 3 talks on this, 5 talks on that. And that is seen as, okay, we've done enough to put in the annual report. But you actually helped nobody, and you wasted a lot of money. Uh, and it's seen as a welfare activity to have done. And so since it is seen that way, nobody's really interested in it then,
yes.
whereas you could actually use all of that money and do something far more useful yourself.
That's true. No, that's very true. My key takeaways from here, and you know, at no point you actually said that invest in these things, because at one point in the initial part, you even said that we don't really need to have in-house counselors. right?
Yes.
If ever have a selected list of counselors, if ever somebody needs to find access in them, right? Focusing on fixing the root of the issue. What you just said, even if you do 100 stress management programs in a year, right? They're still not going to relieve anybody of their stress if the
Yes.
core culture of the company is
Exactly.
constantly fueling that stress. So instead of that, find the root cause of the stress, find the root cause of what is creating this reflection in the emotional and mental well-being of the people in your team. And if you can find the solution and fix it, then do it. And if you cannot do it, then that's a different thing altogether, right? But at least you need to know where is your contribution.
Yeah,
And
and also, I mean, I would add to that is that there is no one single magic bullet, okay? In fact, there will be lots of tiny things, each of which add up to the whole. So, if you do one thing that adds 10%, and then you do another thing and that adds another 5%, and you probably need to do 20 or 30 things together to get the big bang effect that you're looking for. So, if you're going to go around searching for this one single thing which you could do, which acts like a magic bullet, then there isn't nothing like that. Every little thing adds a little contribution to it. And, HR needs to look at it as a multifactorial thing that you're trying to address rather than to look for this one, the key which will open the lock. There is no key which will open the lock.
there's no key, there are no accessories that can solve it until and unless we look at the fundamentals of what are the building blocks of the culture of the organization. There is no fixing of it, and there's no provision that you can provide. And uh, lastly, what you said about the individual responsibility here, Soumitra, because everyone keeps relying, the companies rely on the government, the HR rely on the company's leaders, employees of the organization rely on HR and their leaders or their managers. But at the end of it, each one of us is one person who is part of an organization, and we need to find that individual responsibility also. So yes, in workplaces, while a lot of it depends on the leaders, CXO level people, and HR. One to decide and give the mandate, second to execute and strategize these things. Each individual has their own role to play. So many learnings from this session. So many learnings. Thank you so much, Soumitra. We are already, past the time that we had scheduled. We thankfully have covered all the questions also that we wanted to cover. Thank you so much for joining us. I will look forward to sharing more conversations with you on this topic, because this when things attack to the core of the problem, that's when we can find long lasting solutions.
Yes.
Right? And the conversations and the narratives really need to start happening in that manner, instead of finding accessories and more products and services for the organizations.
Yeah,
There's
yeah.
something that they can work on it on their own, if they just know how to measure it. Simple metrics. So many takeaways from here for our HR fraternity also. Once again, thank you for joining
Thank you
us.
so much. Thanks for asking me. And you asked me earlier when I said, don't call me doctor. Now you know why I said that.
Yes, yes, I get it now.
Okay. Nice talking to you. Thank you so much for asking me.
Yes, have a lovely evening.
Thank you. Bye-bye.
Take care.